Dental assistants and hygienists often share operatory room cleaning, disinfection, and sterilization duties, and the appropriate product must be used for the task at hand, or the results can be potentially damaging to the instruments and equipment and even dangerous for both healthcare workers and their patients. First, the difference between disinfecting and sterilization. Sterilization kills all viable microorganisms, including bacteria, fungi, and viruses, whereas disinfection only reduces the number of viable microorganisms and often leaves behind more resilient organisms such as viruses. The dental operatory is full of bioorganisms from blood, saliva, plaque, and tartar debris and other bodily fluids that result from treating a patient. These things inevitably end up on scalers, periodontal probes, dental mirrors, and other intraoral equipment. However, whether sterilizing or disinfecting, the most important step is the first one, cleaning. Cleaning means physically wiping down the item first to remove visible particles and residue from the surface. Patient care items are categorized as critical, semi-critical, and non-critical. Critical items are those that penetrate or contact soft tissue, teeth, bone, the bloodstream, and normally sterile tissue. Examples include periodontal scalers, probes, and burrs. Semi-critical items typically contact mucous membranes and non-intact skin. Examples include handpieces, mouth mirrors, reusable impression trays, and amalgam condensers. Non-critical items come in contact with intact skin and include things such as X-ray heads, face bows, and blood pressure cuffs. All critical and semi-critical items should be heat sterilized after cleaning. Room surfaces are divided into two categories: clinical contact surfaces and housekeeping surfaces. Clinical contact includes surfaces in treatment areas contaminated during patient care by bare hands, gloved hands, saliva, blood, or other bodily fluids, which could touch surfaces such as light handles, switches, X-ray equipment, countertops, chairside computers, and drawer handles, even pens, doorknobs, and tables. Housekeeping surfaces are floors, walls, and sinks. When cleaning clinical contact items, first remove the protective barrier such as a plastic wrap or barrier film with gloved hands. After removal and disposal of a barrier, visibly check for contamination and then wipe them down with a saturated disinfectant cloth. This will protect against any small undetected break in the barrier. Then disinfect or sterilize the item per the equipment manufacturer's instructions. Because housekeeping surfaces like walls and floors have a limited risk of disease transmission, they can be decontaminated with less rigorous methods than those used on patient care items and clinical contact surfaces. Essentially, what it comes down to when choosing disinfection or sterilization is this: always follow the equipment manufacturer's guidelines. Always. Using a disinfection product or sterilization technique that is not recommended by the manufacturer may end up damaging the equipment and often results in ineffective cleaning that can be harmful to the patient and the practitioner. Well, we really cleaned up that mess. We'll see you next time on The DEZiree Show.